Hello, hello, and welcome to Hygiene Elevated Conversations and Innovations. Today, Nicole and I are joined by Brittany Cox, and we are excited to have a conversation about sustainability in dentistry. So I'm going to turn it over to Nicole if you want to kick us off with the first question.
Yeah, absolutely. Brittany, we're super excited to have you on here today. I know I'm a recent follower of yours, and I've just kind of been digging into everything that you have on your content, and it's fascinating. It's stuff I feel like a lot of people don't automatically think about. And so I'm really excited to hear your take on sustainability in the dental profession. So, kind of starting off, what led you to become a hygienist, and what was your journey like?
That's not a question I normally answer very often because it kind of like the can of worms, but I got pregnant
That's what
really
makes
young.
them fun questions.
True.
I do love those
Super
worms.
fun
That's where we're
question.
at.
Yeah, I got pregnant really young. I got pregnant at 16 and had my first child at 17. And going to medical school just didn't seem super feasible with a newborn, but somehow dental hygiene school did. And so that's what I ended up doing. I started school right after I graduated early from high school, went straight into college, got accepted to dental hygiene on my first try. Luckily, I know that's not how it is for everybody else, but I got accepted really quickly. And I graduated as a dental hygienist at 19. So,
That's
Wow.
amazing.
yeah.
That's a
Wow.
big achievement. Like, you
Yeah,
couldn't
it
even
is.
legally drink.
Yeah.
That's very true.
Yeah, that's
Where were you based out of?
So I live in Texas and I'm based in Texas. I live in Austin now, but I graduated and grew up in the Rio Grande Valley in South Texas. So the very tip of Texas, the very end where it touches the Gulf of Mexico, that's where I grew up and graduated.
Oh, okay. Okay.
gotcha.
Wow.
Very
That will make you
cool.
grow up really fast then. Just
Yes.
everything that you just said. Okay. So excuse me. Um, so what type of practice setting did you start out in then?
So I started out in just like a general practice setting. I didn't stay in the valley too long after I graduated. I moved to Denver. I moved to Colorado, and that's where I feel like I really became a dental hygienist. Like that's when I came into my own. I could do my own diagnosing. Like I was my own practitioner. Super, super different than Texas. Like in Texas, it's very you just can't do a lot. It's definitely not like Colorado. And so that's kind of just where I became a dental hygienist. I had some really good regional managers. Liz Neese with Perio Protect was one of my regional managers, and she was one of my she was just one of my mentors, and she really helped me grow up from like being a baby hygienist to getting my feet wet and everything. And so, yeah, started in general practice and then did that for a while, moved back to Texas, and then just temped around until I found an office that I really liked. And I've been at the company that I work with now, I've been with them for 4 years now.
I feel like there's so much within everything you just said that we could
I
probably talk
know.
about for a long time. So
I'm
I
so
have a
sorry.
similar experience, slightly backwards. So I'm from New Mexico, so
Okay.
different portion of the Rio Grande Valley. And New Mexico is very much known for being a very backwards state. But I didn't realize how forward hygiene was until I moved to Utah. And I thought,
Yeah.
oh, I'm sure they're more advanced than New Mexico. Not the case. In New Mexico, first off, we've been doing anesthesia since like the dawn of time. I've been a hygienist 16 years. We've always been able to do local anesthesia. A general supervision license has been a thing for at least 15 years. So I can do anesthesia with my doctor out of the country. Hygienists have been able to own practices for 15 plus years. And it's always baffled me. Like our brother state, Texas, that we all hate Texans. Just kidding. We're jealous of Texas because it's better in a lot of ways. Anyway,
Bigger. It's really the
you
only
guys
thing.
have, yeah, definitely bigger. You guys can't do it. Well, barely can start doing anesthesia, and it's just incredibly limited. And so it was so mind blowing to me to realize that I was living in a state that was so hygiene forward compared to other states. I just had no idea.
Yeah, I agree
Interesting.
with that because I'm in Colorado and that's where I went to school. And Colorado is probably one of the most, you can do everything here. And I'm afraid if and when I ever move out of state, I'm going to get my ass handed to me because I'm not going to know. I'm going to be like, oh, this is what they are. This is their stage and grade. And these doctors are going to be like, excuse me, ma'am, that's my job. And I'm going to be like, all right, then. So I that it's so
Yeah.
interesting, all the different states and all the different things that they all do. So,
Yeah.
okay. Well, so you graduated, you moved to Denver, and then you moved back to Texas. So, at what point in time did sustainability become something that you were interested in? I know you said that that was something that's personal to you that you do in your own life as well. And now you're really kind of advocating for sustainability within the profession of dentistry and dental hygiene. So, what sparked that passion both in your home life and in your career?
So when I moved back from Colorado, I didn't like, even though I moved back to Texas, I didn't go back to the Rio Grande Valley. I moved to Austin. So Austin is very different. It's like its own little bubble inside of Texas. And they just do things very differently here. They care about if your stuff is in plastic or glass or paper. They care about where your things come from. It's like mandatory to recycle. Like I didn't even know what recycling was really until I moved to Austin, where there's like a recycling bin everywhere and things are compostable, and just the environment being here in this area, it just kind of threw me into it. And just being a dental hygienist, you talk to your patients all the time. You talk to, so you kind of see what their lifestyle is and what matters to them. And I think other people would say that Austin is very like granola or crunchy. Like they do things a little differently here. And so a lot of my patient base, like they didn't want to do fluoride. They cared about the ingredients that were in their toothpaste. They cared about how it affected their planet. And a lot of them were zero waste and like didn't want to buy a floss pack that they were just going to have to throw away the plastic each time their floss ran out. So that kind of is what got me started into that sustainability, is just kind of being in this area and looking at, where in my home can I be more sustainable? And then just a couple of years ago, that's when I started looking more into the practice. Like, this is everything that I'm doing at home. How can I take this and transition it into the dental field? What can I do in my own operatory that is going to make a difference, not just for me, but for generations to come, for my kids going forward? Just because, I mean, plastic, it never goes away. It's just here all the time. And so every plastic thing that exists will always exist, at least in our lifetime and for a lot of future generations. So
Yeah.
it just makes you kind of think about how you do things.
Yeah, no,
Agreed.
I
Agreed.
love that. I remember I had to retake a prereq before I got into hygiene school, and I can't remember what class it was, but I actually wrote a paper about waste in dentistry. And I don't even know what sparked that for me to write that, but I just remember like I worked in a perio office and we did a lot of surgical stuff. So we would have lots and lots and lots of instruments and just the constant tearing of the paper and the plastic. I mean, you could throw away like a bundle of those, the sterilizing packs and in like per surgery. And then we would also, I mean, well, surgery was a little bit different because everything pretty much is like single use and it was all wrapped in plastic that was sterilized. So I think coming from that practice, I was just like, dang, this is a lot of waste. Like, this is a lot. So I did write a paper about that, and it really just kind of opened my eyes at that time. And then when I went to hygiene school, they used Enviro bags, which I had never heard of before. I didn't know that was like a thing that you could actually reuse, these bags. And I remember like saying in my paper, that'd be so cool if someone developed that. Well, and it had been developed, and it was interesting. So, I think that that's something that like we in the dental profession see that every day. We see how many bags we open. We see how many plastic air water syringes and saliva ejectors that just go right into the trash after sometimes not even full use. So when you kind of got in this interest, when you moved to Austin and you're like, hearing all this from your patients and finding interest in yourself, where did you go to learn more and to dive deeper into that topic of sustainability in dentistry?
So first, I looked at a lot of what I was already doing at home. and try to see like what can I transition, right? Like does my office have recycling bins and things like that? So I started looking at that first. It's just what little things can I just adapt on my own? And then I started doing a little bit more research. FDI has a sustainability course. Trying to think. It's their FDI sustainability, and it's this big course. It's like 3 hours long. It took me longer because it's self-paced, but they have a lot of information. And then there's the Environmental Dental Agency or Association also has a lot of information. If you just search like sustainability and dentistry on Google, a lot of stuff pops up, but I just don't think that those two words together is like something that people will search very often, you
Yeah.
know? But there's a lot of stuff on there, and I mean, I pride myself in doing a lot of the research, and so I try to bundle as much of it up as I can and make it easy to read in like a 2-minute article. So there's that
I
too.
think that's awesome. There's so much going on right now. There's a lot of buzz of like microplastics in many aspects of our personal care products, and kind of like you were talking about earlier, patients are becoming more aware of things that are in products. And I think as in general, people are kind of getting to the idea of like, hey, choices I make, my consumer choices are going to have impacts. And we need to be wiser with the choices that we're making. And I think the same applies true of us as clinicians, the things that we recommend and the things that we are purchasing in office where we can control those things. So you were talking a little bit earlier about your master's program and a project that you're doing. Can you tell us a little bit more about that and kind of how you married all of that together?
Yeah, so during COVID, I went back and got my bachelor's degree with O'Hare University, which is owned by Tim Ives and Trisha O'Hare. And after I got my bachelor's degree, they created a master's program, which is like 18 months. And I decided to start that. And I'll graduate in October. And
Oh,
the last 6
congratulations.
months, thank you, almost done. The last 6 months is just a final project. So it's kind of this like passion project where the main thing is patient health. How do you get a patient healthy? Right? Like, what can you do? What can you create to get patients healthy? And I decided to go completely left field and be like, well, look, if we make our environment healthier, if we make our surroundings healthier, well, then by association, people in general will be healthier. If we get rid of some of this waste that we're creating, if we know what's in the products that we use. So I started writing a few articles during my time in that course, got a few of them published, and then I just started doing more research and just really deep diving into it. And my project with them is pretty much just a compilation of everything that I've done. So my articles, all of these podcasts that I've been on. In November, there will be a book launch for the guide that I'm writing on sustainable dentistry. So that'll be part of it. And then just being able to get myself out there and tell companies, hey, this is how I can help you. Like as a consultant, if you don't have a sustainability plan, I can help you create a comprehensive sustainability plan. Or there are certain things that I can help companies do or manufacturers change the way that they do things to make them more sustainable, because that's not really an option that anybody's given them before. So
Yeah.
huge
Well, you're
project.
basically blowing my mind right now,
Yeah.
and I'm excited for you.
Thank you. Thank you. I'm really excited. It's opened up like I didn't realize that during a master's program that I would basically create my own company and like do my own branding as a person. But it's really cool because then at the end of my master's program, I've built this thing that is going to help so many people. And, I mean, what more could you ask for from an end of
Yeah.
a program, like all of it, because this doesn't just affect me or providers, like what I'm talking about affects it's huge, it affects our planet. And so, or ideally, if things go good and people listen to the things that I say, then it will have a positive impact.
Yes.
Well, that's true too, and I feel like there's not that many people out there that are offering, to help with sustainability in the dental field. So I feel like you're kind of pioneering this really cool movement that is not only vastly important, but it's also something that people are finally taking awareness of after seeing years of impact of
Mm-hmm.
non-sustainability, you know what I mean? So I think that that's really fantastic that you're getting to that place that you can start to offer that information to people, and people are interested in hearing that information. So, it's a good relationship there. Well, in your current practice, what are some things that you switched over that you were like, okay, this is not fine for me, kind of a thing that is sustainable that people listening can, implement into their current practice?
So I've been with my practice for 4 years. And during that time, I went from being like a lead hygienist to a dental hygiene director. We're a small group practice, we have multiple locations. And initially, like, unfortunately, a lot of practices out there, they didn't have good perio protocols. So I helped them write their perio protocols. So I sat with the doctors. I said, hey, as a hygienist, going off the American Academy of Periodontology, their staging and grading and what they're recommending, this is what I created. So we are really, really good about promoting prevention in our office, but also treating periodontal disease early. And I think as a dental hygienist, at least, that's one of the most important things you can do, because if you can treat something early, then the process is going to be a lot less resource intensive, right? If I do a prophy and it's going to take me, you know, 20 minutes of scaling, and then they're maybe scheduled for an hour, compared to if I do scaling and root planing, which takes 90 minutes to 2 hours. At that point, I'm using more water. I'm gonna create more waste during that time. More gauze are going to be used. So just more resources in general will be used when you do more invasive or more therapeutic stuff compared to preventative stuff. So treating things earlier prevents the need for those things, right? Like if I treat periodontal disease in stage 1, maybe stage 2 periodontal disease, compared to stage 4, where now patients are losing teeth and they're going to need extractions, then they're going to need implant therapy if they're even a candidate. All of those things compile. Those are other treatments that the patient is going to need because we didn't get to the root cause early in their journey. So as a dental hygienist, I think that's the most important thing we can do in the office is have really, really good perio protocols and follow them, and try to promote prevention as much as we can, which I think we all already do a pretty good job at. But understanding that there's also that prevention isn't just brush your teeth, floss, and then go about your day. It's about sitting with the patient, doing that motivational interviewing, trying to figure out where their hurdles are, helping them overcome those limitations. Because if you can't do that, then they're not going to move forward. And just telling somebody to brush and floss isn't enough. So prevention, it should go a little bit further than just giving oral hygiene instruction.
I would have never married the idea of prevention of disease with sustainability, but I totally get where you were coming from there. And that's a game changer, and probably a little bit different motivation. I don't think you're wrong on any of that by any means. I think that's a really unique perspective of long-term health. And I think that same thing applies across the board with all diseases. The more diseases you have, the more medications, the more treatment, XYZ, the more production, the more resources are going to go into that. So, yeah, that's a whole interesting idea that you just floated.
Yeah. And
And
then
that just kind of sparked something that I was thinking too is, so if you're going into the more invasive procedures and you're creating waste, but I'm kind of thinking like biohazard, like your amalgams, like your metals and stuff like that. So when I originally was thinking sustainability, like I said, I was just thinking, your steri packs and your air water syringes, but that just brought into mind like biohazard. So where does that come into play when we're looking at like, lowering that kind of a waste, and like what are the I guess I'm trying to say, like, what are the stats on biohazard?
So, as far as biohazard goes, unfortunately, none of that stuff can necessarily be recycled or reused or anything like that. Um, There are certain companies that are designated like biohazard companies where like they get rid of the biohazard for you. They do have sustainability measures in place to get rid of those things appropriately. So that's why like when you go to your landfill, you're not going to see a lot of those red bags like all blown across your landfill. Like it doesn't get taken care of like typical trash. So biohazard is actually one of like the least things to worry about when it comes to sustainability, because they have really, really strict protocols on how to take care of all of that waste. But as far as like things like your saliva ejectors and stuff like that, there are companies that you can go to. Like I know you were talking about like the Eco Pack where you can reuse sterilization pouches. Be Sure is a really good company where like they just create their stuff out of recycled material. And the manufacturing process, they are more sustainable. So the resources that they use and how to get their energy in the manufacturing plant is more sustainable than something that's like, maybe made across, in a different country where it's like not ethical, you know? So they might use wind power or solar power rather than like raw fossil fuels to get their energy for their facilities. So even looking at things like that, where it's like maybe the product itself isn't super sustainable, but their manufacturing process and their attempt at being more sustainable and just reducing the amount of resources, that in itself is technically more sustainable.
So, for somebody listening to the podcast and they're like, "Oh my gosh, I want to make some changes." What would be like the first maybe 5 things that you could say, "Hey, let's, go back to our meeting and have a meeting with the office and say, "Hey, can we change like these 5 things to make some sort of an impact?" What would you kind of recommend to that hygienist listening?
So the first thing I would do is see if you have a recycling bin in your break room, right? Like if you can't recycle stuff that has like saliva and blood on it, which makes things hard to recycle in general because most of the stuff we use has saliva and blood on it, then just in your break room, right? Like if you're using plastic utensils, maybe switch to metal utensils and ask your doctor to buy you some metal utensils that you can just wash. So you're not having to reuse all this plastic stuff. The cups that you have in your office, are they reusable cups, or are they like paper compostable cups, or are they plastic? So switching to something like that in your break room, or just putting a recycling bin there. So when you're done with your probiotic soda or your sparkling water or something like that, you can actually throw that can in the recycling bin because you have a recycling bin now. So that would be one thing. It's just your break room. And then the other thing would be to just start those preventative protocols to discuss that prevention with your patients beyond just oral hygiene routine, but actually looking to see like checking blood pressure and looking at their medical history and catching things in the much earlier stages, because that is also going to be less resource intensive for other healthcare places if you can catch something in their earlier stages, right? Like if you can catch somebody's high blood pressure in the early stage where it just has to be medicated, compared to somebody now needing to go get cardiovascular, some kind of like heart surgery, that's a lot more resource intensive. So, doing the things that we're supposed to be ethically doing as dental hygienists would be the second one. And then just kind of talking to your doctor about, things in the office, right? Like if a light goes out, saying like, hey, can we maybe replace that with like an LED light instead of like this random light that you just purchased? Because LED lights are going to be more eco-friendly because they're not going to use as much energy and stuff like that. So I think those are good places to start. And then the last one would be to look at where you're purchasing your products from and seeing if you can purchase those same quality products from a company who's doing things a little bit more sustainably. Like Pure Life has a lot of great products where they like rate eco-friendliness of their products that you're purchasing. And then Be Sure is another one that I love their products. They do like masks and they have gloves and they do air water syringes and saliva ejectors. And they even make like ethically sourced cotton like swabs and gauze and cotton rolls. And you would think that all this stuff is more expensive, but it's really not. And it's not cheap either. Like it doesn't break after you use it. Like when I use my polisher, like the head doesn't break where I end up having to like switch it and use like 3 different polishing profi angles before I'm finally done. They're actually
I've
good products.
Yeah, I've had samples. Be Sure is pretty generous with their samples, and so I've had gloves. Their saliva ejectors are very good quality. So I totally agree with you. It's not crap.
Yeah.
It is good quality stuff that it's going to hold, and it fits in your air water, or not your air water syringe. It fits in your suction. It doesn't just slip out, because we all know
Mhm.
that's like the bane of existence for a hygienist, dropping the
Yes,
saliva ejector.
I
Yeah,
agree.
I've used their gloves before and I really like them. There was a company giving out, I can't remember which one it was, but there was a company giving out, they had like a new product where their Profi paste is in a disposable ring. So it's this plastic ring, and every single Profi you throw away that ring. And it's like it was a nice ring. I like kept it and I was like, "Oh, I thought it was just like, how the companies will send you one to use." No, every single paste came with the ring and you were supposed to throw the ring away after every like use of paste. I'm like, that's 8 plastic rings a day. I'm like, that's ridiculous. So,
If you're only seeing 8 patients too, I'm like,
Ri
yeah.
exactly, times
If you're
like,
only seeing 8.
I work in a practice with 9 hygienists, so multiply that times 9 times just my one single office. I was like,
Yeah.
That's insane." And they made it so that only their, like, you know, paste could fit in it, so, like, reusing it was a difficult thing to do, and the first thing I thought about was, like, what an incredible waste of plastic, like, that's insane. But, you know
So
go ahead.
I use Directa. Directa Dental is a really, really good company, and they make their things very sustainably. Not everything is like biodegradable plastic and stuff like that, but the way their manufacturing facility processes the things and makes them, it's more sustainable. But what I do is I use their Profi paste. I buy like the 80-gram tube and I put it on the back of my glove. And then I just use the
Oh,
Profi. So I actually don't have the only waste I have is from my Profi angle, which
That's
is Be Sure.
cool.
So then I don't feel too bad because it's packaged in paper and then
Right.
I throw it away and it's made of plastic that's already been recycled. So I don't use any Profi cup.
That's
I
very
actually
cool.
really like that. Like those, to me, I think like those types of tips, like if somebody's not like crunchy, but they're like, less waste, like less money, I think that's something maybe everybody can at least get behind. So like a tube of Profi paste, that makes sense. That's a lot of waste.
Yeah.
So I think I remember reading an article eons ago in like either Dimensions or um RDH magazine, something like that, that talked about sustainability. I mean, and I'm talking like at least 12 years ago. So they were using like the blue cloth that you used to wrap your cassettes in, using that as like the patient bib. And so you weren't having that plastic and you weren't having to use the sterilization pouches. You were always using something that was sustainable and renewable, but still had a practical purpose within it. And I always thought, oh, that's interesting. Very hands-on, but very interesting in practice.
I love that. Another thing that you can do too is just like not having napkins everywhere in your office. Like you can have like just cloths. Like that's something that I took from my home that I try to do in my office. Or it's harder to do in the office that I'm in now, but I've seen offices do it where it's like they just have just little towels that you can launder in the restrooms. And you can do that as a bib, just a towel that you can launder.
Yeah, mhm.
Hmm. Yeah,
Yeah, absolutely. That
that's
and
interesting.
also not having, like, the disposable gowns too, is having, like, just wash your gown. I mean, that's what I do, but so we've talked a lot about, like, plastics and stuff like that that we can kind of swap for different things. What are your thoughts on a lot of the chemicals that are currently in a lot of the products that we use? What should people be on the lookout for? Like, the top few that you're like, stay away from those chemicals. What are your thoughts on that?
I think just BPA in general is a big one. And it's really hard to know if something has BPA in it unless it says it doesn't have BPA in it. And then you kind of have to just cross your fingers and hope that they're telling the truth. So that's a huge one that I would definitely recommend staying away from, especially because a lot of our toothpaste are in plastic tubes. So if that plastic tube isn't BPA free, or it doesn't say anywhere that it's BPA free and you can't find anywhere that it's BPA free, maybe don't use a toothpaste in a plastic tube, because then it's leaching into your toothpaste and then you're putting that in your mouth and you're likely ingesting some of it. So that's a huge one. Triclosan is an antibacterial. It's typically in a lot of toothpaste and mouthwashes, so I would watch out for that one too. It causes antibiotic resistance, and if we're using copious amounts of it and we're just kind of like spitting it down the sink, or just kind of getting everywhere, it goes back into our environment, and then that stuff gets put into our water, and then we drink that water. And so it's really hard for us to not get antibiotic resistance if we have a lot of triclosan and things. So I think that's one. SLS is a huge one. I think that it just, not recently, it's been out for like a few years, where like hygienists are like, look for SLS free toothpaste. But a lot of people have allergies, or at least a sensitivity to it.
Mhm.
And we know that it causes inflammation, like it causes an inflammatory response in tissues. So maybe don't use a toothpaste that has SLS in it, or a mouthwash that has SLS in it, which if your mouthwash or your toothpaste is foamy, it likely does have it, even at little amounts. And then just parabens are another thing that they're linked to hormonal disruptions. They contribute to all kinds of cancers and things like that. And ultimately, when you're looking at these things, you think, oh, well, what does looking at parabens have to do with environmental sustainability? Well, if it has parabens in it and it causes cancer, and that patient now has to go and get cancer treatment because they were using something that was causing cancer and causing them to get harm. Exactly. Right? Like there's this bigger story. And I think that if I could leave you guys with anything, or leave your audience with anything, it's just that every single little choice that we make has this big reaction. And we may not know it because we don't like do the research or take the time to understand it, but it does, right? Like even using the products that I use, like if you wouldn't give it to your kids to put in their mouth, like maybe don't put it in your mouth,
Mhm.
So same thing with like cleaning products and stuff like that too. Just all the choices that we make in our home. How does that impact your overall health? Because if it's if it's at a detriment to your overall health, then you're going to take more resources to make you healthy, compared to if you just start now to take those things out.
I think that's so cool, because I kind of came into this episode wanting to learn more about recyclable stuff and reusable stuff, but you've opened up this whole other dimension of thought process. It's just been mind
Mhm.
blowing thinking about the prevention of any kind of disease, whether it be oral or systemic, is going to have the overall effect of the products that we eventually use causing too much usage of these things. So that is just, I'm sorry, but that was just like so mind blowing and so cool. And I'm so appreciative that you brought that to the table, because that's not where I thought this conversation was going to go. And you've completely
Yeah.
like changed my mind about thinking about these things. So I really, really appreciate your insight on that, and how you've brought that, to everyone's attention. So what is the best way that if somebody wants to learn more about this, get more involved in this, you know, maybe work with you, or, start their practice on working with, you to consult with, how can they do that?
So the Environmental Dental Agency, if they're wanting to like change their practice and the way that they do everything, they have an EcoDot certification. And that's a really great resource to start with, is just going to their website to learn a little bit more, and then maybe going for that certification for their office if they want to. Or there's the FDI sustainability training. That is another really, really good one. They will learn a lot from that. And then at the end of the FDI sustainability training, they take you through like these little challenges that you can do to make your office more sustainable, and just to be more sustainable in general. And then if they want to reach me, you can probably just look up my name at this point, and you'll probably find one of my articles, which I love the fact that I can say that. But you can also reach me at brittanycoxrdh@gmail.com is my business email. And I have a website that's linked to my Instagram. I share a lot of my Instagram. There's a lot of personal stuff on my Instagram too. You guys will meet my dog and my kids and my husband back there or something like that. But, you'll get some knowledge from my Instagram.
Gotcha. That's really cool. And then I know you mentioned that there's like a sustainability book coming out. Can you tell us a little bit more about that and what's going to be in it?
So I'm trying to use like all of the articles that I've written and just like reformat them to create my book, which is really cool because I can at least attempt to do that. But a lot of it's going to be, from the prevention standpoint, why it's important for hygienists to move into being the healthcare providers, the preventative specialists that we can be, and screening and doing all of that. That'll be a big portion of it. And then we'll talk a little bit about, maybe reducing plastics, reducing waste, chemicals, and stuff like that. So some of that'll be in there, but it will likely be only like 100 pages, and it'll just be a nice little guide that somebody can go to. I don't think I'm going to charge for it or anything like that. I might just have it as like a PDF download on my website for anybody who wants it.
That's awesome. So I got my, sorry, I'm like starting this podcast all over again now. I got my, well, I'm a candidate for my biological dental hygiene certification through the International Academy of Oral Medicine and Toxicology. And I feel like there's a lot of concepts that overlap. And one of the big ones when I was going through my certification was amalgams. And obviously, there's a huge environmental impact with amalgams. But something we don't even think about, that I didn't think about, was cremation with amalgams. Like, we're incinerating amalgam and putting it in the air.
Never thought about that.
Right? That's a little alarming. And how many offices don't care about it. But the weight of amalgams and how much, I mean, there's a huge environmental impact with just directly amalgams and how offices handle them. So I know there's a few companies out that have something that's like, it just fits on your high-speed suction and it encapsulates it and you can safely dispose of it, because I know so many offices don't do that because of cost, amalgam separators and whatnot.
I thought offices were like it was necessary for them to have an amalgam separator. Is that not the case in some states?
Well, I'm sure there is. I'm sure there is, but there's offices that don't. There always is. So
yeah.
But yeah. So anyway, I think there's a lot of overlap, I think, with sustainability and the movement of, being wiser with our purchases as consumers, as professionals. But I think you brought the idea of prevention in there so much better, so much more power that we have as hygienists to prevent, to, I don't want to say save the environment, but to really have that impact long term for people. So
yeah.
Okay. Well, 2 closing questions that we have. Nicole, do you want to ask the first one?
I would love to. So, as a new grad myself, I actually really enjoy hearing these answers. But if you could go back and give yourself a piece of advice as a new grad, what would it be?
I don't know, honestly, because I love the journey that I've taken with everything so far. I've been very blessed in this hygiene career, and I I think the biggest advice would be to be a part of your association. That would be the biggest one, because I'm the president of the Austin component now, but for almost like I've been a hygienist for 10 years, and for like the first 9 years, I really wasn't a part of my association. And I see how important it is. I like, now that I'm president of my local association and I've been on the board for TDHA, I see how much we do behind the scenes to keep progressing our profession and to make sure that it doesn't become obsolete. And I think that, as students, at least, they don't see those things. They don't see what goes on behind the scenes. They don't get to go to like annual conference or go to like their state conference and things like that. So it would be a part of your SCADA one. And then if you can attend like a TDA or, your local association's conference or even national conference, go do that. Go talk to other hygienists, because, hygienists just love hygienists. Like, we will take anybody in and we're like so encompassing and we want to give you all of our knowledge. So just being able to be on that conference floor with so many of us and get to know and learn from so many of us, that's what it means to be a hygienist, is to have the kind of community that we have. And you're not going to get that by just being in school. Sometimes you have to go outside of that.
100% true. 100%.
Has nothing to do with sustainability, but if I had to,
but hey, it's the advice for
somebody
you.
advice.
It totally does, though, because hygienists are the ones, we are prevention specialists, and we know what that impact is long term. So investing in our profession, allowing us to practice to the full scope of our license is going to allow us to be even more effective at that prevention. So it is totally in there. Okay, last question. What is something that took you years to learn as a hygienist that you wish you would have learned in school?
That I have a voice, that the things that I say matter, whether I'm saying them to my employer or whether I'm saying them to the patient, even if it doesn't feel like what you're saying matters in the moment, it still made an impression. And decisions are made by little impressions, right? Like when we're on Instagram doom scrolling, we ultimately end up buying something because we saw it a few times, or we ultimately end up following somebody because we saw their content enough times where we're like, okay, fine, I'll follow it. You follow the algorithm. So same thing with like just conversations in general. Like everything that we say makes these tiny impressions, and eventually that person will take what you said and make the choices that essentially you want them to make. So that's at least helped a lot in my profession, like in my little office and talking to my doctors. Maybe they don't make a difference, right then and there. Maybe I said, hey, can we do this instead? And it didn't automatically get done. But then I bring it up at conversation again later. And I just know in my mind, like, it's not going to be the last time we have this conversation, though, until eventually it happens. And then I get my way.
The squeaky wheel is the one that gets fixed, right?
Exactly.
Awesome. Well, Brittany, thank you so much for spending this evening with us and just giving us so much to think about. I really do appreciate your time.
Of course. Thanks for having me. I really appreciate being here with both of you, and you're doing amazing things. I can't wait to dive into your podcast more.
Thank you.
All right.